confirmed cases. In Johannesburg, more confirmed cases. Last week our concern was the CBD inner city and the CBD and the areas of Mayfair. You can see it is still our big concern this week. It's where the number of cases is increasing quite exponentially. The CBD of Johannesburg, the parts of the CBD that includes Mayfair. So we have the largest number of cases, active cases there, over 700 active cases are there. We also would still be very concerned about the areas I've referred to, Doornkop, Dobsonville, and the south, the western parts of Soweto that are kind of linked to the West Rand and Roodepoort in that area. I want to draw your attention to the fact that the area we were concerned about earlier on in Johannesburg, which was Ivory Park, the number of active cases in that area have essentially, there's a significant improvement as a result of the interventions we made. In that area, the same thing in Tshwane and in Ekurhuleni, we are still, the hotspots remains the same. The hotspots remains the same in those areas, but the hotspots in the West Rand, you will see that although I showed you earlier on that we have significant recoveries in the West Rand, especially in Merafong, but we've got new cases coming up in the West Rand. New cases are coming up in Mogale City. And those cases, as I say, are linked to some mining activity in those areas. And the area which was a big concern for us, which was Merafong, it's still a big concern, but we have significant recoveries in that area. We have less active cases. 2 weeks ago, when we sounded the alarm bell, it was because we were just getting many cases at the same time. So interventions, the first storyline is that when we identify these hotspots and then we mobilize the resources to intervene in the hotspots, it does work. Principally, the storyline is it does work. Interventions do work. When you identify an area that has got new active cases, you arrest that by contact tracing, including those contacts having to be quarantined and additional measures in those areas. It does work. And that story that it does work is showing us and spurring us to do much more. But there are areas like the CBD of Johannesburg, when the area is very crowded, it can be extremely difficult. When it is also a transport node where a lot of people come together and it's a business hub, it can be extremely difficult. So we are extremely concerned at the moment by the substantial increase in the number of cases in the CBD of Johannesburg, in the CBD of Tshwane, that gets into the western part of the city of Tshwane, right up to Atteridgeville, and in Ekurhuleni. There is a new area in Ekurhuleni, the south, the Alberton area has got a significant increase in the number of cases. And the West Rand, we were concerned about Merafong, the Carltonville mining area, but we now have the Krugersdorp, Mogale City area in the last 7 days, also as an area of concern for us at just sub-district level. We're also sharing with you the exact numbers. In 7 days, the actual increases per sub-district. You will see the inner city of Johannesburg now has the largest number of cases in Johannesburg, but 438 new cases in 7 days. And it will be followed by the area I was referring to of the western part of Soweto, Dobsonville, Doornkop, Snake Park, Roodepoort, and that area also included a bit of also illegal mining activity. We're extremely worried also about that. And then after that, you have the other areas in Johannesburg which are concerned. In Tshwane, we've got 2 areas that in the last 7 days have reported more than 100 cases. The first area would be the Atteridgeville, Pretoria West, Lodium, Lotus Gardens belt. And the second area would be the Elderain, Waterkloof, that's the Centurion part of Tshwane. So there are 2 areas of concern for us in Tshwane. As I said, there are 2 areas of concern for us in Johannesburg in the last 7 days. And our interventions are going to be directed there. In Ekurhuleni, we have always been concerned about Ekurhuleni North. That includes Tembisa, portions of Ivory Park, portions Winnie Mandela. But there's the Davidton area, Davidton-Etwatwa area in the last 7 days has become an important area of concern for us, as well as the Boksburg area, which include portions of Bedford View, Germiston. The numbers, you will see them there, essentially. And the West Rand, you can now see that actually Mogale City in the last 7 days has surpassed Merafong in the number of new cases. So we've had 95 new cases in Mogale City. That's the point we were explaining to you, that we have been able, the interventions to ensure that to fight the fires in Merafong, that intervention has worked. We have arrested the growth in the number of cases in Merafong, but we've got a new area that's coming up that has got 95 more. So in the last 7 days, we have had more cases in Mogale City than in Merafong. Again, we do the same. So our interventions is to ensure that we trace all the contacts. We have a sense of what is the source of the outbreak. Where people need to be quarantined, they have to be quarantined in that way, and others essentially receive our attention and help in that regard.